to win and to succeed. The question is, having had that background and having had that consolidated basis, what extra steps do you put to bring other communities and other nations into your global agenda or national agenda so that you can aspire into the leadership of this country? Now, the challenge that Mudavadi has, which is also similar to the challenge that Kalonzo Musyoka has, is that they have refused to get out of their tribal cocoon base. So that you find Stephen Kalonzo Musyoka operates regionally within the Kamba nation. Occasionally, once in a while, you'll find him in Kwale. Occasionally, you'll find him in Mombasa. But there's no consistent, targeted approach to the other nations. Mudavadi also suffers the same thing. Every time you listen to Mudavadi's movement and speeches, apart from the economic agenda, and remember our politics, although we might want to move it to the level of economies, it goes back to which other people are you bringing on board? So you find that Mudavadi is operating from his home, he goes to Western, forever in the Western thing. Now, that is a community that is willing. It is already given to you. They just want to see you really reach out to other areas, other communities that might not have a presidential candidate, but they're willing to listen on a coherent message. I think that is the challenge of the Okwa Kenya movement and the leadership within that. Now, and I'm not holding brief for the deputy president, but it is easy to see that the deputy president will always reaching out to other regions. That is why you see the Musambweni thing gave him an oomph in terms of saying, I am beyond Rift Valley. You see him going to central Kenya and challenging and engaging the people of central Kenya. That way you see that in that province, people are divided. We are not seeing our respectful leaders go out. And I'm not saying that our Kenyan politics must be ethnic organized. That's not the conversation. I think we need to have clarity from that. But it is important to appreciate somebody must come from a base. That base is what gives you a negotiating opportunity to get into the table. How you increase that base? Biblically, there is a story of the people who were given talents. One was given 5, went and added 5 more. One was given 3, added 3 more. One was given 1, and he buried it. Now, if our leaders do not see that opportunity, that they have been given 3 or 5, and therefore to add it, they will always be doing 3 steps forward, 2 steps backwards, marching on the ground. And that's a big problem of the second, of the Mudavadi-Kalonzo axis. They need to up their game. They need to be seen beyond their tribes. They need to go, even if it's not tribal organization, let them engage the youth. Let them engage the middle class in this country. Let them create a conversation that mobilizes and marshals peoples together to their cause beyond the tribal calculation.
Okay, and that's criticism One Kenya Alliance has received from their competitors, that these regional kingpins are sort of coming together. Daktari Njogu, as we put this matter to rest?
I think taking from where other has left, he said clearly that Mudavadi is a very good man, amiable, he's easy to do business with, and easy to convince. And he says that if he was to pick a presidential successor to Kenyatta, he'd pick Musalia Mudavadi.
Out of his experience.
Out of his experience.
Perhaps,
And I think Mudavadi is... Okay, okay, fine. That's a fine fight. But what I'm saying is that, unfortunately, in politics, there is no provision for hard picking. And once you hard pick, things don't go on well. In terms of Mudavadi, I remember one of his generals, I think it's Savula, MP for Lugali, challenging that some seats should be vacated so that they can be occupied by people from other regions. So as Kioko is putting it, Mudavadi has been domesticated in Luhya nation. Kalonzo has been domesticated in Kamba nation. Mudavadi has been unable to display courage. People cannot trust anybody who does not display courage in their future. Finally, Mudavadi has been using the issue of the economy and the debt situation to market himself. And unfortunately, that is not resonating very well with the people, because there was one time he was in charge of the treasury, and the issues of Goldenberg were there, which have not been resolved at today. So to many people, from where I sit, is that issue of economy is just trying to get advantage, and it do not sell very much. And I think the other thing Mudavadi is debating on so much is support from the deep state. And I want to maybe advise Mudavadi that support from the deep state can oscillate from one person to the other within a fraction of a second.
All right.
So if he's depending on support for the deep state, he's going to be in for a road shock. Finally, Kabisa, I want to say that there are some politicians in this country who have been playing politics of subsistence. You want to be a kingpin of the Kaba nation, kingpin of the Kikuyu nation and other nations, so that you can get a cut of the national cake, but you don't have what it takes to prepare yourself to the highest level of the destination.
Yes, it's important for me to clarify. Dr. Barua, I think either you didn't listen to me clearly or you deliberately distorted what I said. One of the two must be true. I said if I were to handpick, big if I were to handpick, Musalia Mudavadi would be one of the people I would consider. So it's very important to get that. It doesn't mean there are no other people I consider to be good leaders. He is one of the people I consider to be good leaders.
That's what I call if you are.
Okay. Since that is
secondly, this is important. I think sometimes we shoot ourselves in the foot by eating food and declaring it poisonous for others to eat. If you declare that it's a habit we are developing now of calling people tribal kingpins. Show me a politician in Kenya who is not a tribal kingpin. There is none. None at the national stage, maybe at the local stage because people come from the same tribe. So it is a label that we are using to try and disenfranchise other leaders. And Kioko rightly said, while he came and contradicted himself a little bit, that somebody has to have a base, you know. And I have always argued that what we call tribal mobilization of politics, underneath the ethnic groups that exist, there is also an economy that binds them together. If you go to Ukambani, you will have to deal with issues of water and infrastructure and historical marginalization. If you go to Mount Kenya, you'll have to deal with issues of tea and coffee and small business and a lot of other things. If you go to Western, you'll have to contend with issues of sugar and maize and border issues. If you go to Turkana and the whole of northern Kenya, you'll have to prioritize security, marginalization, infrastructure, and therefore, to call people tribal kingpin is a misnomer. And if all of these guys start at the local level, all politics is local, we say, it starts at the local level, then when people demonstrate an ability to go beyond their tribe, then you would say, okay, now this one is coming to unite us. We were able to look at him, even though he's not from our tribe. Let us try and work with him. But they grow from there. Maybe to add, sorry,
briefly, because we need to move on.
We need to move on. Maybe to add. I think the conclusion of Mashmodera is what I meant, that you must have a base. At the moment, it's the tribal base. But we're looking for leaders who've grown beyond the tribal base, who have nationalized their local issues, who have taken their local, so that Akamba who's feeling disenfranchised in Machakos can resonate with a Digo in Kwale over the same disenfranchisement. That thing of depending and always holding back to the tribal cocoon and not wanting to grow beyond is what we are challenging, and is what we are saying that the next leadership must aspire to nationalize local problems.
Exactly, and also you are saying what Kioko, my friend, is saying, had said, is a plane must take off from an airport. They can't take off from anywhere. And people are taking off from where they come from. The other thing is, my friend Arthur said that there are problems like water in Ukabani and so forth. I think what I would like people like Kalonzo to be doing as they try to entice themselves, the people, is to tell us, since they joined politics, what have they done about the water? It's not a matter of maintaining the same problem so that you can use it politically season after season. We want people, these politicians who have been there for many years, to tell us, I've done this for my region about water, and so give me a chance to go to the next level. The other issue which we have finally, as I conclude, is that as much as we are talking about tribal kingdoms or fiefdoms, a person must come from somewhere. But you also have to show an effort that you have the ability and the intention to integrate your leadership with other communities.
And
that is
to the national level.
That is lacking in both Mudavadi and Kalonzo.
Well, that's according to you, but definitely we'll continue interrogating the political developments. Allow us to shift focus on the way it is. We want to start with the latest in terms of the health plight in the country, the effects of the lockdown and whatnot. It has been over a month since President Uhuru Kenyatta imposed a lockdown in the 5 diseased counties of Nakuru, Kajiado, Nairobi, Machakos, and Kiambu. Have the stringent measures helped reduce the spread of COVID-19 in the country? According to health experts and government officials, the positivity rate has gone down. Now, is the lockdown worth it after all? Chebet Berir tells us more.
It has been 30 days since President Uhuru Kenyatta imposed a lockdown in the 5 counties that were termed disease-infected.
That all gatherings and in-person meetings of whatever nature are suspended within the counties of Nairobi, Kajiado, Machakos, Kiambu, and Nakuru until further notice.
At the beginning of this measure, 26% was the highest positivity rate on March 26th, but now this has reduced by more than half to 11.2%. However, the death toll has been on the rise. Before March 26th, 8 people died per day, but currently the average daily mortality is 17. The highest number of deaths recorded was 26 deaths on April 13th. An average of 1,500 Kenyans are admitted in hospitals, more than 200 of them in ICU.
It's good to know that our numbers of infections actually almost reached like the peak and now started going down. But we want to say that it is not yet time to throw caution out of the window.
Though not under lockdown, Uasin Gishu County has recorded a surge in COVID-19 cases.
Uasin Gishu is along the northern corridor, northern transport corridor, with lots of movement. You know, when we did the lockdown, we didn't stop trade. So trucks and other vehicles conveying public goods still move.
We continue to have very many referrals, and allow me to say that out of the patients, we have nearly 40 to 50% are from outside our county. So there needs to be, a good response, a good coordination, and when the referrals have to be made, again, this inter-county conversation would go a long way.
Even though the lockdown and curfew has hit hard the country's economy due to limiting the hospitality and transport industries, experts say that the stringent measures could be worth it after all.
The best way is to suffer for better, because once the pandemic is contained, then they go back to their normalcy. But look at a situation where the eateries are open and the surge continues, and you even find the workers are infected. So we're protecting everybody.
According to the Kenya Medical Practitioners and Dentists Council, despite the third wave, Kenya's ICU bed coverage is still wanting. There are a total of 861 ICU beds, a quarter of which are in Nairobi. Counties like West Pokot, Meru, Lamu, and Busia still do not have ICU beds. As the country steps into the next month with the COVID-19 crisis still looming, the uncertainty over the future of the vaccination exercise to stem the spread of the virus might redirect efforts back to the measures that worked to flatten the first and the second wave. Chebet Birir, KTN News.
So that's the latest in terms of the curfew state so far and some of the measures put in place to protect the population. Dr. let me start with you. We've just received that report, and according to it, a total number of ICU beds in the country, 861, a quarter of them are in Nairobi, so roughly 200 of them. Some counties have no ICU beds, as you mentioned earlier on, and the numbers are definitely wanting. What's the pandemic taught us, even as we interrogate our healthcare system so far? What's your take on this, especially since health is a devolved function?
I think what the pandemic has taught us very many lessons. If you look at the interview yesterday of Honorable Senator of Busia, or his experience with COVID, and also in the write-up by Governor Kelechi Murungi, and I'm mentioning it because those are prominent figures who have gone through this disease. They have come out with a change to people after this situation. The other thing is that as much as they are prominent, given the status globally, they could not, and the nature of the disease, they could not be evacuated to other countries for specialist treatment or so that they can get healed better or something. So one of the things is teaching is that we as Kenyans or any other nation in the world should endeavor to have a state of the health system up to date and competitive globally, because when the disease attacks you, the closest attention comes from your people. What I'm saying is that since the health sector is devolved, the governors and the leadership of the counties in general should aspire to ensure that they upgrade their respective health systems so that a hospital in Kirinyaga or Kutus, where I come from, can give as good facilities as Nairobi Hospital. Once you do that, you are going to increase our capacity. The other thing is teaching is that when there is a global pandemic, it is each one for themselves. Like India, right now, has stopped exportation of AstraZeneca because it's India first. So even for a country like Kenya, it's good for us to be prepared for such scenarios so that you get an attack like this, we should be able to take care of ourselves.
Okay.
In terms of research, the government should also prioritize funding of research institutions. In mind, I have 2 institutions in this country who are dealing with viruses. One of the KEMRI itself is more known as KEMRI, which has been working on viruses for a long time. The other one is Institute of Primate Research, which is little known, but is doing a lot of research in terms of viruses. And in fact, it's actually been working on development of vaccines. So the government budget should actually, any government using power should actually prioritize funding for research institutions so that they can get at least 4% of our GDP going to medical research, or to research generally. Finally, as I conclude, I would like to say that the containing measures have worked. The positivity has gone all the way up to 11% right now as we talk, with an average of about 15, 16. But the containment itself is causing a major havoc on the economy. And what I would have advised myself is that these measures are several, and they could have been prioritized. To me, the biggest cause of the upsurge was the political rallies, which are being held by political leaders across the board.
Super spreader
events. Those are super spreaders events. Now that those super spreader events have been sort of contained right now, and people have developed different ways of campaigning for themselves, I think now time has come for us to review the containment measures. For example, the hotel industry is suffering. They are all closing down. The tourism is suffering. So we can have now a revision of the containment measures and be able to have protocols for every sector. As I conclude, I want to say that we have closed Nairobi and the 5 disease areas. And not much is happening outside the 5 countries. We hope we are not creating a room for corona to increase in those countries, in those counties, in which case you might find yourself, those counties locked against ourselves, so that they'll be the one locked to protect us, which is going to be the same scenario. So the citizen responsibility is also very important. People have to wear masks and do what it needs. This disease cycle is 15 days. From the day you get it, the day maybe you'll get healed. If people can follow the protocols, we can reduce the disease to a manageable level of below 5% as soon as possible.
Okay, that's definitely noted. And Arthur Odera, he's put an interesting point on the table. The 5 counties are definitely reeling from the effects of the lockdown and all, but focus on the other counties outside these 5 red-zoned counties, especially since Dr. Amoth mentioned that some counties next to the Northern Corridor might be having a spike in infections due to the easy transport and with the borders in place and the mobility as well. Talk to us about this.
Clearly, Jesse, you know, the devolution of health, of public health anyway, to me is both an opportunity and a risk. An opportunity in the sense that these counties, even before COVID, we had an opportunity to deal with the health menu that is available within our health system, but to put some level of focus on prevalent problems locally, which then one needed to develop the capacity to deal. For example, if you look at Kenya, there are malaria-infested areas where malaria is the most common disease. There are areas that are more prone to typhoid, related to water, related to the prevalence of mosquitoes and so on. You would then have an opportunity to deal with local issues and be more attuned to the local health challenges. Whether they are doing that or not, I think is a big question. If I was sitting in the Ministry of Health, I would do an audit related to that kind of perspective that gives local hospitals, dispensaries, health centers the capability to deal more with the problems that occur right there where they are. Unfortunately, in health has become a cash cow. In most counties, it's a source of cash for the governors and their officials within the county. You find sub-district, sub-county hospitals. My sub-county hospital called Kocholia, you will find patients sharing beds, patients sleeping on the floor, patients taking many hours or days without having been seen by a clinical officer or a doctor. Those are the basic minimums, if you ask me, that a patient needs to be seen. Often they go there and even when they have been seen, there are no drugs at all, there is no equipment with which they can be, and therefore they are referred elsewhere to get the attention that they need in terms of tests and drugs and so on. And yet the equipment facility that was negotiated between the national government and the counties should have provided that equipment for all the tests that are required at the local level. But that's not the case. And sometimes it's a challenge of buildings and so on. And I think that when you look at it from a vaccination and a COVID point of view, I think the lockdown must have provided us with an opportunity to relook at our strategy on vaccinations. In my view, the fact that we permitted importation of other drugs, Sputnik, Moderna, Pfizer, J&J, and so on, does that provide an opportunity? Or is it a risk to our strategy towards making sure our people are vaccinated? Look at it this way, Jesse. Economic power is different between different Kenyan individuals. If you take Kenyans as a team of people queuing to be vaccinated with AstraZeneca, if we provide other vaccines that people need to pay for, we are taking a chunk of people who can afford off the queue and therefore allowing those at the back of the queue to get to the vaccination faster. That, I think, was a big mistake made by the Kenyan government. I think it was politically motivated. I would urge the president and the Minister for Health to relook at that and say, is there a big risk at all in allowing private players to import vaccine? You can set price guidance, and make sure that those who can afford can go and get it, and those who can't, AstraZeneca will still be brought and provided across the country.
Okay, so vaccination is definitely the new front line to fight the COVID-19 virus. Joseph Kioko, allow us to take a short break. When we come back, we'll definitely interrogate the vaccination drive so far. The uptake is good according to the numbers that are lining up to take the vaccine, but we'll definitely interrogate who is the weak link in this particular fight against the pandemic and the challenge in the health sector, because fingers are definitely pointed to the counties in terms of accountability. Stay with us.